Hello everyone. I would like to welcome you all to another webinar session conducted by Codio Consulting. My name is Shomik and today we will be talking about dental care. And joining us today is Dr. Puja Bahl. She runs her own practice here in Delhi in Chittaranjan Park, and she will be discussing several dental related topics such as dental diseases, oral health practices, and some common causes of tooth loss, to name a few. She will also give us a few key demonstrations which we can incorporate into our day-to-day dental lives. So let's kickstart this webinar. Thank you, Dr. Bell, for joining us.
Thank you.
And if you can give our viewers a brief introduction about yourself and how you decided to get into this line of work.
I don't think I really decided. I think God decided for me. I just gave my exams for entrance exams for the PMP, and I eventually landed up in dental school. To cut a long story short, I've been a practitioner for the last 26 years, and I've just grown to love the profession even more than I did when I was a student. But one of the key things that I would like to tell everyone today is how to brush. None of us knew. I didn't know how to brush till I went to dental school. So how you brush is the most important thing. Most people just learn by either watching their family or watching their TV, and those are not the right practices. So I just would like to demonstrate how to brush, something very basic and very simple.
So you're a dentist, right? So how does one differentiate between a dentist and an orthodontist?
So an orthodontist is a person who specializes in braces, okay? And he's usually, braces are the children will go for braces, right? From say ages 12 until 16 or maybe normal, unless you're an adult and now you want correction. But then you need to read up on the person's, there has to be a master's in orthodontics. And a normal general dentist like myself, so I'll be practicing about everything.
Okay, thank you. So can you elaborate on teeth health and like what kind of food is best in order to promote that? How do you promote?
I don't think people would like to eat healthy. So, yeah. So it's a very interesting thing. Okay, so the Romans, they were trying to experiment in the old times because they didn't have good brushes or good toothpaste. So they were trying to figure out how to avoid dental decay. And they realized that if they had sweet before the meal rather than after the meal, so that cut down the rate of decay of teeth by almost 50%. So it's a very small thing. If you like to, go with it instead of saying "Khane ki baat ki ab meethe mein kya hai?" So meetha pehle kha lo, and have your food after that. So that kind of flushes the meetha away from your teeth. So tooth decay, cavities, which is the main cause why you're running to the dentist, ke dard dukh raha hai, toot gaya, all that.
And what would you say are some of the common misconceptions that people have when you talk about dental hygiene and care?
First misconception is not to brush early in the morning. That's a very thing that we use. Brush karo, phir nashta karo. Okay, that's the first thing, right? And then the next one is that dant nikalwa lo to aankhein weak ho jayegi. They're not related. The optic nerve is way far away from your teeth, so that's not related. And then the other thing is dant ki cleaning kara loge to dant weak ho jayegi. Also, if you get your teeth cleaned, likely to stay healthy.
So, of course, this is something that a lot of us have definitely faced, I would say, growing up, and that is a fear of dentists. Because we all grow up and we feel that, dentist ke paas jayenge, daant nikalwayenge.
Right.
So how do you handle a patient, because I'm sure you must have faced a lot of patients who
Every day.
scared, children especially. So how do you deal with that?
So usually in the first sitting, especially if it's a child, adult we can still handle better. We never do any procedure. We just let the child come into the clinic, come sit on the dental chair, fiddle around with some equipment, show them how we work, and we let the child just go back home without any trauma, without any bad. Then the next sitting, yes, we can work a little bit. For the adults, people who are very scared, I routinely sedate. Give them an Alprex before the appointment.
Best practice.
Makes easy. Life easy for them, life easy for me. They're snoring on my chair, I can work. All is easy peasy.
Yes. Perfect. So I believe you have some equipment with you today, and you'd love to give a demo to all our viewers.
Absolutely.
Please.
So the first thing I'd like to start off with how to brush. All right. So also the toothbrushes that we use should be soft. Okay. I don't want anybody to be scrubbing your teeth with some very hard brushes. Don't do that. It's just scraping the enamel off. Enamel is just given to you once in a lifetime. It's not going to grow back. Like any other skin cell will grow back. This is not going to grow So how you brush is very important. After brushing, flossing is the next thing that I'll be talking about. Very, very important. Lazy people like me don't like to floss also. So I have got a water flosser line right here to demonstrate that. And a mouthwash is always a very good idea to reduce the number of bacteria in your mouth. All right, so we start with brushing. Okay, so I'll like to move a little closer to the camera so we can see how to apply the toothpaste. Okay, that is very, very crucial. So can everybody see, please? Okay, so instead of the thing being like this, you see a TV commercial, the toothpaste is typically on top. Okay, so let's not do that. I want the toothpaste inside. So just wet your finger and make the toothpaste go inside the bristles. All right. Okay. Now, if this is somebody's mouth, okay, it's just a model, but okay. So we start brushing the eating surfaces. So I don't want you to be going very hard. Just go into the bristles and into the grooves and just clean gently. Okay, that's all. You're not going forward and backward. You're putting your toothbrush in one place, gentle movements, gentle agitation, so that all the food which is in the grooves is going to clean. Okay, same for the lower. So you do the eating surfaces first. Same agitation movement, just a little bit front back, and you're done. All right, then we come to the sides. So you put your toothbrush on the gum and you bring it to the tooth. It's like a mini rotation. Okay, very gentle. You go thrice in every place. At no point are you going circular or going, no, just go gentle from the gum to the tooth, even in the front, on the side, from the gum to the tooth, inside, on the gum to the tooth, lower back, from the gum to the tooth, right? Same we go for the upper. So from the side, on the gum to the tooth. Here, gum to the tooth. Again, gum to the tooth. Inside, the gum to the tooth. I know that I'm very clear, but okay. Inside, gum to the tooth. So that is how a brush is done. Ideally, number of strokes should be between 100, 150. That's the number of strokes you need in one brushing. And at no point are you making any rolls or scrub motions. Very gentle brush.
Yeah, because I believe I'm talking from personal experience. Growing up, I was told that you've got to run it back and forth at least I think 30 plus times on each side.
Okay, so everybody just do this little test that I'm telling you. Take your nail, just rub it on your tooth. Just rub it on your tooth. अच्छे से till the gum level. Gum level तक जाओ. अब अपने nail पे देखो कुछ white आया क्या? Yes. So that white that you have on your nail now is the bacterial film. It forms between 6 to 8 hours of your brushing, right? And this is the one which is the maximum bacteria going to cause a maximum damage. So this film shouldn't be there. So if you brush after breakfast, you will break the film completely. Okay? And next we're coming to flossing. And I have my dear model over here, and please allow me to wear my gloves where I will demonstrate flossing. Okay, one of the reasons why flossing is important is because with the brush, you're cleaning the back and the front of the tooth. Right? What about in between? That is where 90% of the cavities come, right? Because आपने आगे पीछे तो brush कर लिया, in between teeth. Okay, so we have a very nice model who's been nice enough to be with me, and we will demonstrate how to floss. Okay. All right. So this is the floss. Any normal waxed floss will do. So we cut off maybe about say 8 to 10 inches of the floss. All right. You wind it around your middle finger like that. Okay, that is how you start. You wind it around your middle finger, maybe turn a little once more if you want to make it a little tight, and then you use your index finger and your thumb to work. Okay, so we have the model here, please. Be good enough. Okay, so we're trying to floss on the front teeth, right? So you kind of go in a seesaw motion gently before you don't hit the gum. Okay, go seesaw, and just go around the gum, and that's it, and out. And you can see around it. See this. So you got this white scum. Okay, so that is the bacteria. That is the one which is going to rot your teeth. So that's the front teeth. Okay, so we go on the back teeth. That is a little thing. Can you see how I'm working? You can see. So we go slow, gentle. Flossing is never with a lot of effort. It has to be very, very gentle. Seesaw. Okay, niche maybe. Okay, so like that. Otherwise, you can see a YouTube tutorial of how to floss. I'm sure they're very good. Okay, so now we have a very fancy equipment here, which is called a water flosser. So for lazy people like me who don't like to do this, but I just demonstrated. Okay, so this is a water jet. Okay, it comes with a lot of you could say force, right? And in between teeth, you just put it here. This release. Okay, this release. This release. But yeah, that's how you can just clean. So after you brush, go chuck, 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 stop it. No worries.
So the water flosser works on a jet.
No, it makes the water jet on its own, right? It's plug-in, right? You have water. You can even put, what I typically do is I put my mouthwash in it. So it's a 2-in-1. Chuck chuck bhi hoga, mouthwash bhi ho gaya, sorted. So this is a good investment if anybody wishes to buy it.
And how much does it cost in the market?
These plug-in ones cost I think about 5+. Rechargeable 5,000. The rechargeable ones are a little lesser. They're like 2.5, but I don't recommend them because life it gets salty. If the battery doesn't really work very long.
Then you'll have to keep buying it after.
Yeah, all the time. So, and I wanted to talk about some preventive practices, especially for the children.
Yes.
Okay, how to prevent cavities in children because they're the ones who have the biscuits and the toffees and whatever. Okay, so if this model can, okay.
Sameer has a question for you from England.
All right.
Is the water flosser more effective than the basic usual floss?
Yes, it is definitely more because the manual dexterity sometimes is not very good. You're not able to reach some corners. नीचे में ऊपर में सब सामने में तो अच्छे से floss हो जाता है mostly, but पीछे में people don't have the manual. Like I can do it because I've been teaching it, right? But for everybody normal person, एक दो दिन करोगे you'll get sick of it. कौन करे? So
that question came from Sameer Ray in Leeds. Hi Sam.
Hi Sam. Okay, so we talked about preventive in children, right? So there are two practices that we very routinely do. This is something called a sealant. So I'll just move it closer to the screen if you can see. So this is a kind of a glue. You don't have to drill into the tooth or anything. So with this glue, you just apply it on your tooth like that. I mean, of course, the dentist does it for you. You're not doing it yourself. So you just apply it on the grooves, okay, especially in the kids. And then it gets cured with this light. So you just kind of do light on it. It cures, it just prevents the cavities, right? Khana andar ghusega nahi, the cavity hoga nahi. Simple.
So does it like it automatically fills up the gap?
Yeah,
over
it
there.
automatically fills up the gap. It lasts for about 2 to 3 years. Not very expensive, uninvasive procedure. Great for the kids.
And it doesn't make it worse either.
No, it can't make it worse. It just clean and fit. You're not going to drill into the tooth actively, just clean and fit. So that's
at what stage does it come to a point where you decide that okay, fine, that now it's a point where you have to get a root canal done or you have to get the
you understand that.
No, not you, of course. As like when do you decide as such?
See, in India, we don't have the concept of dental insurance and stuff. So most people don't go to a dentist till it's hurt.
They wait for it to get
wait for it to hurt. I mean, I'm asking across the board, when is the last time any of you seen a dentist?
Few months ago,
Okay.
had a cavity.
Okay, exactly. So it was in the front you went because it was looking bad, right? But piche mein kahin khana so till it hurts. In India, we only see the patients when it's hurting. So tab tak the root canal ka, if not a root canal, then extraction for sure.
Right. So we have a couple of more questions also from a lot of viewers because we were promoting this webinar and then a lot of people started writing to us and they said we got questions, we wanted to ask. So we thought, we'll just ask these questions also.
Yeah, sure.
So first one we have is Anubhav from Bihar. He's asking, how often should I get a dental checkup done?
I would say ideally twice a year, but there are some people who have a lot of cavities or a lot of issues. They need to go every 3 to 4 months. Okay, supposing you visit a dentist once and you do 1 or 2 cavities and you're sorted, so twice a year is enough for you. But supposing a person who's had multiple root canals, cavities, hote rehte hain, they need to go earlier. They need to go every 3 to 4 months. Ordinarily, twice a year is enough. You don't need to go more than that.
You've got another question. What are the best ways to practice good oral hygiene at home? This is Konkana from Shillong.
Okay. So the most important thing, and I can't stress this enough, is to brush after breakfast. Get up in the morning, just rinse your mouth, have your breakfast, and then brush after. If you don't do that, if you do what you're already doing, it's like get up in the morning and brush. It's like kamra bada chakachak saaf kar diya aur mitti ki balti li aur dal diya usko. So mitti to wahin ki wahin rahi, the khana is back in your mouth. What did you really clean? So have your breakfast, brush after. If you can use water flosser, great. In the morning, if you're too rushed, you don't have the time, fine. Use the water flosser. but you must. And to keep your gums in good condition, very important, just massage your gums with your finger every time. You don't need to apply any gum paint. You don't have to do anything. Just simple thing, massage your gums. Keeps your teeth healthy.
We've got another viewer, Mohit Devrani, who's asking, can teeth repair themselves?
I wish they did. I'm sure there'll be some technology at some point to say that they will, but at the moment, I'm sorry. God gave you one set and that was about it.
How do I keep my teeth white? How can I improve the whiteness of my teeth?
See, if I can talk in very layman terms, teeth become yellow or they change color usually with tea, coffee stains. Some people smoke, right? Their food, some I've even seen people having multivitamins, they get stains on their teeth, iron stains. If you're having an iron supplement, uske stains will happen. So essentially, if you brush after breakfast, most of the stains will not happen. Most of the stains will not happen. And if you go for a routine checkup, mostly cleaning, polishing ho jayega, so that will get sorted. But if you want to whiten, then that's a bleaching or something that if you really want to go that route, you can. But essentially, if you brush after breakfast, the stain aayega hi nahi, breakfast ke baad kuch khaya nahi. Dant saaf hai.
And also we
Stays
see
healthy.
these commercials where they say they have this kind of a sticker that they put on the teeth, and if you remove it, then it makes it whiter. Is
For
it
a
removing
while.
of, is it, so
No.
it's a myth, is it removing something from
No,
your
no,
teeth?
no, no, it's
Removing
not
a layer?
removing it. No, 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 it's not. I have got some, I think, with my back. Okay, anyway. So that's basically those kind of, it's called a gel. Okay, it's got sodium chloride. So it's basically the ozone which is released, or the, you could say, whatever, particles which are released, that kind of lighten it for the timing. But it's a reversible process. Any lightening you do, even bleaching that we do in-house, is a reversible process. Lasts about a year. The one that we do in-house, वो strip वाला तो 1-2 दिन के लिए रहेगा, and that is the end of the story.
So that's if you have a party or some
Yeah,
function
sure,
to attend,
of
that will
course,
take care of it.
of course.
And it's not at all harmful for the
It
teeth.
depends. I don't know what all is available online, but what we as dentists we give, so obviously we give safer options, right? I don't know what is available online at the moment, so we have to. read
So
up
which
on that.
one would you recommend, like, so that to give our viewers
There's something called Smilo Shine. They have a very safe product. We have sodium chloride based. It's like salt based.
all right.
So very, very safe product to use.
So we have another question from Mayank from Calcutta. He's asking, why should I have dental x-rays taken?
Good question. So most problems, like I said, start in between. So if your teeth are stuck like that and there's a cavity in between teeth, I cannot see it. As your dentist, I can't see it. So we need x-rays to look between teeth to see whether there are any cavities happening in between teeth. Because by the time we see the cavity in the mouth, it's already very big. So if we can detect it early on the x-ray, better chances of just filling and saving the tooth. By the time that if we see the cavity, the thanda garam lag raha hota hai, root canal and all of that. If you want to avoid that, just simple fillings, always get routine x-rays done.
We have Sumit Bajaj who's asking, how do I clean the tongue?
Good question. Best thing to do is just with your toothbrush. Okay, small gentle brushing on your tongue because that has a maximum bacteria in the mouth is on the tongue. But don't use those tongue cleaners and all of that. Just use your brush. If you don't want to do that, a gauze on your finger. You're fine.
So you mentioned the number of strokes we need to do, of course. So, but somebody's also saying, is there a time allotted to it? Like, how much time should I brush? So do we go with time or do we go with the number of strokes? So the number of strokes. that
Time
you
is
mentioned.
inconsequential. आपने कितने मग्गे डाल के नहाया, अच्छे से नहाना है.
True. So what, we have another question from Gaurav from Sonipat. He's asking, what is tooth sensitivity and why do I have it?
So sensitivity can be multiple reasons. Question is age of the patient who's complaining of the sensitivity. If it's a young patient, most probably it's a cavity. If it's an older patient, chances of cavities are usually lesser because बुड्ढे लोग थोड़ा सा chocolate कम खाते हैं, right? So उन cases में usually gum recession की वजह से sensitivity हो जाती है. So this thing कि we have toothpaste लगा लो ठीक हो जाएगा usually is not true in all cases. You need to go for a checkup, find out why it's sensitive, and then address the problem. If it's just something with the toothpaste can cure, the dentist will tell you. He said toothpaste लगा लो and you're sorted somehow.
We have another question from Shalini. She's asking, how long does a tooth implant stay?
Great question. See, it depends on the, I would say so many things, whether how old the patient is, are you diabetic, what is your bone strength, Are you a smoker? All these things will affect how long your implant is going to last. Typically, you can expect maybe 15 years from an implant. But if you do say, कल से जाके smoke करना शुरू हो गया, obviously 6-7 साल में हो जाएगा. And all your money will go down with it.
And when should somebody consider dental implants? As soon as they've gotten the tooth extracted, or should they wait, or how?
See, it depends on the treatment planning of the case. That's the most important thing. We say replacement is crucial. The moment you have extracted a tooth, you should already have a treatment plan in place. It can't happen कि अब दांत निकाल लिया, अच्छा बाद में सोचेंगे क्या लगवाना है. Not like that. You think before, plan, and then you get it done. So replacement is essential. How you replace, whether with a bridge or with an implant or with a denture, that is a call you can take. But you have to replace any tooth that you extracted, except for the wisdom teeth. Wisdom teeth we don't really bother about so much.
We've got Sameer from Leeds again. He's asking for a capped tooth, if that is feeling sensitive, what could be the main cause for a capped tooth to feel sensitive?
See, it depends whether the cap was put after the root canal or before the root canal. Usually, caps are mostly 90% put after root canal. So in that case, sensitivity होती नहीं है, because the root canal essentially उसमें आप nerve जो है वो and the blood supply to the tooth is gone. So sensitivity होगी नहीं. But अगर बिना उसके लगाया हुआ, yes, there are chances that they can be at the cavity हो रहा होगा underneath the caps. Very possible. Happens all the time in fact.
But it is more also advisable that you get the root canal done before you get either a dental implant or a capping done. So we've got another person from Bangalore, Kriti, who's asking, should I use a mouthwash regularly?
A mouthwash is always a very good idea because the mouthwash lowers the number of bacteria down in your mouth. But the problem with most mouthwashes, they cause little stains on the teeth because of the chlorhexidine content.
Yes.
So I usually recommend all my patients, if you use say A brand, which is red in color, use a B brand, which is blue in color after that bottle finishes. So stains the chance for us to come with that.
So keep changing the color.
Keep changing the color.
That's all.
That's it.
Wow. So that's so simple.
Simple. Dentistry was never complicated. It's very, very simple.
We've got another interesting question. After how many days or months should we change our toothbrush? And does cleaning of the teeth makes the teeth weak by any chance?
Changing of toothbrush, I would recommend after every 3 months because the micro bristles, especially these plastic brushes, I'm not very happy about. The bamboo brushes are one option which have come up now, and you can definitely explore the options. Because bamboo brushes are natural bristles, they won't scratch your enamel so much. These are plastic, usually end up scratching the enamel.
But also in the market, you get these, a lot of them are like your hard, soft, medium, ultra soft.
I wish they would
Which ones do you
discontinue.
go
I
with?
wish they would discontinue the hard one completely. There's no point. Okay, so usually I would recommend a soft brush. I never like to use hard brushes. I will recommend because your enamel cover is not coming back. So each time you're brushing, you are cleaning, but the enamel is also getting a little abraded every day that you brush. So you have to brush, but go gentle.
So, but you are basically.
So and also like I've taught everybody how to brush. I teach all my patients how to brush, and I also tell them when you brush, be there mentally. Otherwise, your muscle memory is going cut. That's the end of the story. Yeah. So just be there when you're brushing. So because it takes about 3 weeks for the habit to break. So 3 weeks once you change the way you brush, then you get a good practice in, and then you're fine.
Rahul, from Delhi, do you recommend any specific brands of toothpaste for adults?
See, all toothpastes should have, okay, according to at least allopathy, they should have fluoride. Okay, that is the main thing which is going to hamper the thing from cavities progressing in your teeth. We have a lot of, I would say, naturopathy. You could say there's Dabur, there is Himalaya, there's so many options. I keep using them. I don't have anything against them. Okay, I like to sometimes switch to a non-fluoride brand and say, okay, I want to use a Dabur or a Miswak or a Himalaya, right? So at the end of the story, how you brush is way more important than your toothpaste. Okay, if you're making a good job of the brushing, it doesn't matter what soap you're having a bath with, right? As long as you're bathing well, something like that. So it doesn't matter what toothpaste or toothbrush also for that matter. How you brush is very, very important.
We've got another question from Akanksha. She's asking, what precautions should a diabetic patient take if they want to implant new teeth?
See, again, oral hygiene. Okay, the main problem in the diabetics is because of the blood sugar. okay, the amount of blood sugar going to the gums is way more than normal. So, अगर आप implant कराओगे उसके बाद if you don't get enough oral hygiene, as in you must brush, use a water pick, use a mouthwash, then the chances that your implant might not go inflamed. The main problem is the inflammation around the implant. So go to oral hygiene practice, brushing after breakfast, after dinner, simple things. Simple things.
So you got Shalini asking another question. She's saying if you had a filling done after removal of cavity and there is sensitivity in the tooth, is it time that we should get the filling replaced or has the cavity come back underneath?
Difficult to say without saying. Need to go to a dentist and show and see what the problem. Sometimes fillings can crack. If it's say a 10-year-old filling approximately, there might be some cracks and chips of the filling. You can get it redone.
We have another question. It's from Prateek. This is something I can actually relate to because even I had faced it many years in the past. If a tooth gets broken, do we need to get the root extracted immediately?
Good question. I usually want to save as many roots as possible. Okay, I'm talking as a clinician now. So the other day there was this lady who walked in, maybe about 52, 53. She just had roots in her back. Front, she had decent, just filled up with roots in the back. And she didn't want to wear a denture. I didn't want her at 50 to be wearing a denture. She didn't want to put implants because there's expense involved, right? So what we really did was all those roots, some were root canal treated, some I did. So we just kind of made, if you can understand, some root stumps. Okay, some tree stumps kind of thing all over her mouth. And the comment she sent me was, I've had a Snickers chocolate after 15 years. And I'm so happy because she was able to chew. She wasn't able to chew the whole way, like really, but okay, it was I would say something better than nothing.
Yes.
So till the root is really so badly infected that you can't save it, because what God has given, believe me, I can't. Okay, no dentist on earth can do what God did. Right? So save whatever, even if it's a root stump, get some little bit of filling on it. It'll give you something to eat instead of getting it extracted.
But once the root is exposed, there's no other way other than root canal, right?
Root canal is root canal is going to stop the infection from going inside. Right?
Yeah. So you
that's
remove the
done.
root altogether.
No. Root canal is essentially that we're just taking the infection out from inside the root. The root stays where it is.
All right.
The root stays there, and then you kind of make a kind of stump.
All right. You got another question from Puja. She's asking, how does one strengthen their teeth and gums?
Simple massage, gum massage. Brush, massage your gums every day. I can almost guarantee.
Is there some sort of an ointment that we can use for gum massage?
Just with your finger. Unless it's kuch infection hai to alag baat hai. But routine mein, on a normal, I'm talking on a normal day, just at night spend 2 minutes on your gums.
2 minutes, that's it.
2 minutes. It's as simple as that.
All right. So we've got another question from Manoj. He's asking, what is the reason for the gaps between the teeth? And what could be the best solution for that?
How old is Manoj? No idea. Okay, that's fine. So gaps between the teeth usually occur for, say, middle-aged if there is cavities in between. Older generation, the gums kind of shrink down and then there are gaps. So those we can usually fill. So just go for a checkup, see why the gaps are there, see why the food is sticking.
We got another question. Is there anything which can keep your gums white?
Gums white, teeth white.
Teeth white.
Teeth white.
Gums more cleaner.
Gums pink. See, some pigmentation is there, like it's your skin color. Okay, some people have dark colored gums. Laser is one option that you can explore. Okay, so what we do with the laser, just slough off the top surface of the gum and thoda sa niche se pink tissue aa jata hai. But aapko phir repeatedly karna padta hai because like keratin, it's like your skin color, like you can't run from that. So just as long as you keep your teeth and gums clean, they'll be healthy. Even if there's darker pigmentation on it, at least they'll be healthy.
Then we have Mohit. I think he's recently become a father. He's asking, at what age should my child first see a dentist?
Awesome question. So just to reply to Mohit, how even oral care for an infant is very important. Even when the teeth are not there. Okay, even then you have to clean the mouth of the child, which is something most parents think, haan ji, jab dant aayenge tabhi brush karna. Right? That's not the case. So even when the baby is small, so you wrap a gauze on your finger and gently go and clean the baby's mouth. every day.
Every day.
Every day. Okay.
Nowadays there are plastic
No, those are brushes. We're talking of when there are no teeth in the mouth.
Yeah.
Okay, and even those plastic brushes, finger brushes, are useless. Okay, I've used them. Useless. Okay, I'm truly telling you.
So for children, like when they, I think first is the milk teeth, right?
Yeah.
So
And
by
usually
at-
8 months old
yeah,
babies. Yeah.
at what age do they start falling out? And by like from what age to what age?
See,
should
the
milk teeth be
eruption
gone?
process usually say between 8 to 10 months normally. Okay, when the baby is 8 to 10 months, the first छोटे दांत सामने आने शुरू होंगे. They will usually fall between 5 to 6 years, sometimes 7 years. So that's the first time the teeth will start falling. Okay, so there are about 20 milk teeth, and there are 32 wisdom teeth. I mean, adult teeth are 32. So they start falling when the baby is say 6 years old, 5 to 6, and usually by the time they're 12 or 13, they have almost all their permanent teeth inside their mouth.
So speaking of wisdom teeth, we have Poonam from Chitrakoot who's asking, should a wisdom tooth be removed as soon as they come out or only when they cause me pain?
See, what has happened over, I would say, evolution is we were designed for 32 teeth.
Yes.
Okay, that is why God gave us 32. Right now, what has happened is because our eating habits have changed. Okay, from having very raw foods which our ancestors used to, we have started having very processed food. Processed food में 2 बार आप chew करते हो inside. So the jaw is shrinking. Over evolution, over hundreds of years, the human jaw is shrinking, which is why our generations have had to cause wisdom tooth problems. कि wisdom tooth आएगा तो निकाल दो, right? But I would still say if your jaw is broad enough to hold that wisdom tooth, please keep it. कोई भरोसा नहीं बुढ़ापे में जाके वो एक दांत रह जाए खाने के लिए, right? So keep it. Don't just extract it because you feel like it, right? Extract it only if there's an issue. If not, please keep
Just
it.
because it's called wisdom tooth, just don't
No,
remove it.
not
That's
at all.
just
It's your third molar, and it did have place in your mouth.
It has a purpose.
It has a purpose.
We've got another question from Prateek. He's asking, are dental issues hereditary?
You would like to blame it on hereditary, right? We all like to blame it on our parents, but I don't think so. You could say, okay, there's some relation, but most of it is because of our own. It's like me saying, okay, I'm diabetic because my mom's diabetic. Okay, they must have been the genetic predisposition, but it does not absolve me of the responsibility that I did not look after my health. Right? Also, so some genetic, I could say, maybe times. I could say crowding of teeth, how your smile is, all that is genetic. So maybe if your dad had braces or your mom needed braces, maybe you will also, because your smile is genetic. Okay, but your gum health and teeth health is usually not genetic. That's something that you're doing. That's
only.
Yeah. I've got time to take responsibility.
We've got another person asking, I grind my teeth too often.
Yeah.
Is there any oral exercise that I can do to stop it?
Oh. So there are habit-breaking appliances, and I would say something called a mouth guard. Okay, it's a flexible thing that we make for you. So you wear it 24/7, except when you're eating. So then वो habit break हो जाएगी. Some people are night bruxers. We call it bruxism. This particular term of grinding your teeth is called bruxism. Some people grind at night. उनको पता ही नहीं होता. सो रहे रात को they're grinding. So those people usually not able to break their habit. But people who are awake and grinding can definitely use this to break their habit.
And this mouth guard, is it a good idea to sleep with it, or
you have to use? It's custom made for you. So it's tight on your teeth. It's not that it's going to become loose or fall out of your mouth, not at all. So you sleep with it. That's the target.
Okay. We got another interesting question. Is Sensodyne a toothpaste that should be used on a daily basis, or is it something which is just for medical purposes?
See, Sensodyne or any of these medicated toothpaste actually, whether it's Colgate Sensitive or any of these medicated toothpaste, the one I call. So if you say 35 above, all right. So by 35, your gums have started thoda receiving shuru honi shuru ho jati. It's a good idea to use any of these medicated toothpastes every day, not a problem.
There's no hazard, no issues along
no
with
problem. At 35, I'm assuming you're not swallowing the toothpaste, right? You're going to spit it all out.
Yeah.
So no problem.
So we had a few people who had joined in a little late. So if you don't mind, if you can give the demonstration again for brushing teeth.
Brushing, awesome. I think I love to. Okay. So we start first with how we apply the toothpaste. Let me get to a darker thing. Okay, so I think this is a better thing. Okay. So you don't apply the toothpaste like you see in a TV commercial. You don't do this. Okay, just with your finger, you press it inside. You press it inside the bristles so that it reaches everywhere in your mouth. Right? All right. And
supposing these are your lower teeth, right? So you put your toothbrush here, gently go backward and forward. You're not going backward, forward, backward. You're just gently stimulating the bristles to go inside the grooves where the food is stuck, and that tooth food will come out. Similarly on the side, on the other side, right? Like this. And then you take your brush, put it on your gum. Until your brush is not touching your gum, there's no brushing happening. Put it on your gum, bring it onto your tooth. Like this. It's like a semi-rotation. Yeah, quarter rotation. Like this. On the inside, again, from the gum to the tooth. Front, from the gum to the tooth. Here, again, from the gum to the tooth. So at no point any roll motions happening. All right, and you're going very, very gently.
So 150 strokes if you can.
Okay, Puja, I have a question.
Yeah.
If somebody has mouth ulcers,
Yeah.
what can they do and what is the preventive for future mouth ulcers?
Mouth ulcers, especially people who routinely get them, are usually stress ulcers. Stress ulcers. And there's very little, unless you can really alter the way you process life, there's very little you can do about it. It's just like local gels you can apply and stuff. Nothing much you can do.
Any vitamin supplement for
You can have vitamin supplements, they'll help the ulcers heal for sure, but there's no prevention that they won't happen again. Right? You can have a multivitamin, sure, they will help.
any other issue you want to discuss? Gingivitis or cavities or something which really guide.
If you do what I've told you to do, believe me, none of this will happen. But yeah, I think a lot of people think smoking से कोई problem नहीं है, मैं उसके बाद brush कर लेता हूँ. वो क्या खाते? What do they? Huh? No.
Gutka,
Gutka, right? So apart from ruining the teeth, the inside of your mouth lining goes. I have seen so many people. उनका मुंह खुलता है नहीं, आप उनको बोलो ना कि आप करो. The dental treatment is like impossible. उनका it's all fibrous inside. It's like a pre-cancerous condition, but cancer हर एक में नहीं होता है. But your mouth will not open. आपका दांत दुख रहा है, cannot help.
We have another question from Ruchi. She's asking, I don't have sensitive gums, but my gums burn when I eat spicy food, and she's looking for a solution.
See, most likely she has gingivitis. Okay? The easiest thing for gingivitis, one, start massaging your gums, two, get your cleaning done. So once your cleaning is done, there's no tartar on your teeth, all this will settle. It's because the gums are inflamed somewhere, so you have the spicy food, या कोई नमक तेज होगा तो वहाँ पे लगेगा.
And how do you massage your gums?
Just with your finger. You don't have to apply anything. वो पुराने ज़माने में बोलते थे सरसों का तेल और नमक, right? But the thing nowadays is we have iodized salt, and it's very grainy. I would not recommend that anymore. What some of my patients like to use सरसों का तेल and haldi, and I'm fine with that because haldi काफी tasty सी होती है. So, but ये नहीं कि पूरा पूरा haldi को सारे दांत पिघल जाएंगे. So just take one drop of सरसों का तेल, just a pinch of haldi, and just that much is enough. Right? So there was this patient who came and said, "मैं रोज करता हूँ जी, पी ले दांत."
Not a sight to see.
Yeah,
right?
very bad.
Is early white teeth a normal or is it an aspiration? So are there shades of color of teeth?
Oh, there's shades of colors. Usually God has given you something like when I'm just saying, okay, when a baby is born, it's like perfect, right? So God gives you perfection. So your skin color, your tooth color, it's all matched. Okay, if it's a dark colored person, uske सफेद दांत होंगे, वो हंसेगा तो तुम्हारे, you all just look at his teeth. So if God's given you, it's always off-white. Your teeth are never white, right? They're always shades of it. And whatever God has given you is usually best for you.
So is happy dent misleading?
No, Happy Dent is just
Right.
No. So, okay, coming to the Happy Dent. So, we were talking of whether you can't brush in the office. Okay, everybody's working, how to maintain your teeth after lunch. So, have a non-sweetened gum base like Happy Dent or Orbit. So, the thing that they do is they just clean all the food stuck on your teeth. So, that will go with the gum. So, then at least they can dance half. There's no food like stuck in between your teeth. So, I guess that's what the ad says, like shines.
Thank you so much, Dr. Bell. It was lovely having you. We'll still keep the chat box open in case any of our viewers have any questions. So we'll just give it a few minutes to see if there are any more questions coming in.
Absolutely.
Yeah?
Absolutely.
And if anyone in the room has any more questions in the meantime, please feel free to ask. Any
Anybody has
myths,
any dental concerns?
any dental concerns, any myths that you want busted?
I know.
Dental myths.
Is it charcoal good for discussion with. I've heard a lot of ads they come in, right?
See the charcoal, if you understand the negative positive, right? So charcoal is positively charged, if I'm going to go negative, either which way. So the bacteria kind of get attracted to the charcoal. Okay, so you could use a charcoal brush. They're soft brushes. I have nothing against them at all. In fact, it's a good item.
There are some charcoal, powdered charcoal which are found.
See, I have again just you see anything that you put inside your mouth, make sure it's not rough or grainy. Okay, so if the charcoal wala thing is grainy, what I would typically like to do, malmal ka kapda hota hai, usme se double malmal lo, usme se chhan lo. Whatever drops on, that is worth using. Anything which stays on your chhani, don't use it. Because if it's grainy, aapka enamel scratch hoga. Dance half honge ki nahi, wo to is a different story, but your enamel will get scratched, which is what I think even Dabur has improved their manjan. First, their manjan was very grainy, right? So anything that you use, make sure it's very soft, very, very soft.
We have another question from Ruchi. She's just asked, how essential is an implant? Because this is what most dentists suggest in case of a problem.
So like I said, replacement of a tooth is essential. How you replace with an implant or with a fixed prosthesis, the reason why most dentists are asking or say advising implants is because in a fixed prosthesis, what we do is, let's say for example, ye kisi ka humne saath mein hote nahi. So a fixed prosthesis, साथ वाले दो healthy दांत हैं, हम उनको grind करते हैं, उनके ऊपर हम cap लगाते हैं, and then use it as a bridge, right? So essentially, I'm compromising the health of the adjacent, right? If I don't want to do that, okay, now that we have implants are available now, that is the reason why we say implant करा लो rather than a bridge, because bridge में आपके फिर साथ वाले दांत की भी हम life थोड़ा सा compromise करते हैं, right? So in implant सिर्फ वही दांत जो गया उसी के जगह आपने दांत करवा दिया. So that is why dentists nowadays, because implants I would say 20 years ago the options नहीं थे India में, right? Now we have, and इतने expensive भी नहीं है. I'm talking of say 8-10 years ago, one implant was like a lakh of rupees. Now we've come down to about say 25,000 odd for an implant, which is all right, slightly expensive. I'm sure the cost will come down further, but it's a good option rather than कि आप denture करना शुरू कर दो. I wouldn't want to wear dentures, even no matter how old I am, right? So implants are a good option.
And for how long does a bridge hold? I got my bridge done in 2011, right? It's still there, but
Yeah,
now,
bridges hold 10 to 15 years easy, sometimes even more.
okay, because
sometimes
nowadays
even
I'm feeling as if I don't know, it's going weak maybe.
Just get an X-ray done. You'll come to know whether basically the health of the bridge is on the health of the teeth that it is holding, right? So just go get an X-ray done. If that is fine, then it's fine. If there's anything to be done, obviously your dentist will tell you. Right?
Because even I have like this tooth of mine, it's a cap.
Yeah.
I had broken it back in '94. I got a root canal done. Didn't have anything done at that point in time.
Right.
The doctor said, don't do anything, just leave it be after
Right.
the root canal. It's a dead tooth, but just keep it as is till the
Right.
color starts to change.
Right.
And I think it started to change finally in 2007.
Okay.
So,
gray in color.
Yeah, it started turning gray. So that's when I finally got the thing drilled down and I got a cap done. So it's been 15 years now.
Yeah.
So
It will last you.
it'll last.
It should last you.
There's no this thing of go get it changed, get
No,
it checked up
no.
and all. Nothing of the sorts.
Right. Check up. Obviously, we recommend आप जाओ, but I don't think.
One,
Yeah,
Yeah.
sure.
so there's this the
Wisdom tooth
wisdom
or
not
not?
exactly.
Okay, one molar.
One molar.
Okay. Smaller. Yeah.
So molar. So I got it extracted like long back,
All right.
right? And did not replace it with anything.
Fair
so
enough.
that the
Gap has got filled.
gap has got filled up
Yes.
with the gum.
Adjacent teeth.
Yeah.
Yeah.
No, with the gums actually. So there's a gap between the two. Right? But it's fine with me. So I'm able to eat. I'm
See,
able
you
to do
think
everything.
it's fine, right?
There's a-
You think. No, see what happens is when you extract a tooth and you don't replace it. Okay, if I can just use my hands to show you. So this is the adjacent two teeth. Over the years, slowly these two teeth will start drifting into that place. Okay. If this is not bad enough, this is not so bad. When they start drifting, इसके और जो साथ वाला दांत है, वहाँ पे खाना फंसना शुरू हो जाएगा. जो ऊपर वाला दांत है, we call it supra-eruption. That starts wanting to come into this place. So for I would say 8 to 10 years after extraction, you still have the option of replacing it. Anytime more than that, ऊपर वाला दांत निधर आ गया होता है. We call it a scissor bite. कि वो जगह वैसे free है, but the moment you close your mouth, shut. You can't replace it.
So what should I get it done now? Like it's been
अभी बात करते हैं after we're done. We can have a checkup.
And like, I lost a tooth on Saturday.
On Saturday, all right.
And,
Too soon.
Yeah.
Huh.
But the root is still there.
Okay.
So do I need to get it treated?
Is
Because
it-
I think it's already
Is it root canal
RCT,
treated?
yeah.
Agar root canal treatment हुआ है, तो either you can kind of have a stump like the filling, like I was talking of earlier. It may not be like a big tooth, but it'll be like something for you.
We have another question. I think he's asking, does salt impact toothpaste performance? As TV commercials talk about.
I hate to break your hearts, but they don't. I hate to break your hearts. Yeah, I mean, what do the companies do, right? They have to come up with something new. So, ठीक है, कभी नमक डाल दिया, कभी, like I'm saying, सरसों का तेल and namak, according to our, I would say, Ayurveda, right? They say सरसों का तेल namak is very good, but that is when सेंधा नमक was used, rock salt, और वो भी इसको double छान करके करते थे, not like straight up.
And also one more thing I wanted to ask was, and something from personal experience, from a friend's personal experience actually. What had happened with him was that he decided to get braces done, but at a very, very later, like in his 30s.
Right.
He's getting his braces done, but now what has happened is that the doctors have told him that he's had to have 3 of his teeth removed in order to get that, in order to push. Why is that? Like, why remove teeth in order to just put
Okay.
something back in place?
So it's like supposing you have, say, orthodontia we're talking of now, right? So if your teeth are like this, okay, there are enough spaces for me to push your teeth back. I'm putting force slowly, I'll get them back together. That is how your smile will do. If your smile is already like this, and I need to say, for example, it's like this, or in your friend's case, it's like really bad. How do I and where do I move the big teeth? Right? I need space. So we don't extract the front teeth because they're very important for your smile. So we usually extract the premolars and gently move the teeth.
Okay.
So that's the reason why he needs to have extractions. Because I'm assuming his teeth are like popping out of his mouth and not looking nice. So then you need to create space. Either you have natural spaces, but mostly लोगों के पास नहीं. Very few people are lucky enough to have natural spaces कि हम बिना extraction के फटाफट पीछे कर रहे हैं, and everybody is happy.
So that's why it's best to get these things done at a younger age, because then you don't have to exactly have the fear of getting any of your teeth removed.
Mostly, if you can say visit, especially for kids, if they can go to the dentist between 9 and 12 years, 9 years actually, so the dentist knows कि दांत किस stage पे है, mixed dentition किस stage पे है. So if they can just gently coax the dentition into a good place, then that's the ideal scenario. Without braces. Kal braces karne padenge, so the baby's face is growing, right? So you have space to accommodate the teeth. Once you have a place for an adult, then it's very difficult. Very, very difficult.
Perfect. Thank you so much, Doctor.
Thank
It was a
you.
lovely session.
Thank
It was
you
a
so
lovely
much.
one-on-one session, and with everyone also in the room with us for it.
Love being here. My first ever.
Yes.
Went well.
Great. Thank you so much. Thank you all our viewers, and thank you everyone for all your questions. It was a lovely session on dental hygiene, and I hope you can all walk away with something new that you all have learned. I know I have learned many things, and we'll definitely start brushing at night too.
Please, after breakfast, most important.
And after breakfast, yes.
Most important.
Thank you so much, Doctor.
Thank you. You should check the number. Gloves on it.